Thank you very much. Happy to be joined by Dr. Jordan Lee, a pulmonary disease specialist at the Queens Medical Center. You listened to the report that Sarah just did. It's staggering to think that Hawaii is right there at the top along with Colorado. Interesting, you noted they have legalized recreational marijuana. So it's, you know, the cat's already out of the bag there. Are you surprised by these numbers that we're all starting to hear in the news every day?
Yes, thanks so much for having me, Howard. I am definitely surprised by the amount of recent reports. Just recently, the numbers are up to about 300 nationally, and this week we're up to about 450 cases across the U.S. in 33 states, and about 6 deaths so far, which are either confirmed or related to vaping.
One of the things that hasn't been concluded or conclusively linking what exactly is it, but what are you seeing in terms of the connection with the use of e-cigs, vaping, and some of the health issues that you're coming across?
You know, it hasn't been so much of a problem recently, or up until recent. So they're starting to pick up on it more now that it's so popular. As was mentioned in the slides before, that vaping is a lot more popular amongst Hawaii's youth and our teenagers. So I think there's going to be a resurgence of kind of this epidemiology and kind of incidence of vaping-related illnesses.
And there's a lot of controversy, too, over just simply the names of some of the products that seem to appeal to children, rainbow and unicorn and cotton candy, et cetera. I think when it first came out, wasn't there kind of a thought process like, hey, maybe this is a better, safer alternative to regular cigarettes?
Correct.
We're learning that's maybe not the case.
No, and I think it was marketed quite well for our youth, particularly like those names. They're very playful. The flavors that are sold, they're like cotton candy and bubble gum. And it was used sort of as a kind of transition to get patients and people off of regular cigarettes, which we know have been caused a lot of major health problems, heart disease, cancer, high blood pressure. So this was thought to be a safer alternative, but what we're finding now is that there's a resurgence due to the increased amount of use of related illnesses.
Okay, so what should parents, friends, family, coworkers, if you see somebody vaping, and what are some of the signs that you should start to look out for?
I mean, you can look for the common things such as cough, shortness of breath, a little chest pain, but they can also have very nonspecific symptoms such as heartburn, sore stomach, diarrhea. So these are very nonspecific, but obviously if you're starting to have symptoms, and we're alerting healthcare officials that to be a little bit more investigative about asking about vaping use, e-cigarette use, and if you've been using it within the last 90 days and you're having these symptoms, think about that and go see a medical professional. So.
And as we start to get closer to the winter months and the flu season starts to kick in, if you have the flu on top of some of the side effects you might get, it's only going to exacerbate all the problems, true?
Correct, Howard. So what we're seeing sometimes is that there's this wet lung that can happen from vaping, and we don't know if it's, like I said, from either the ingredients or the carriers, the solvents, but that compounded with infection, as you know, and just a plug to get your flu vaccines, those two compounded can be really disastrous for a lot of patients. So.
All right, well, it seems like we're just kind of on the leading edge of really starting to see what's going on here, but appreciate your time. Thank you for the info.
Anytime.
All right.
Thank you.